Hello, good morning, and welcome back. I'm Dr. Anastasia Horonis, clinical psychologist, passionate about helping people who are going through the process of addiction recovery. I'm a practicing clinical psychologist and I'm also a researcher in the field of addictions. And I like to jump on here and provide you with some tools to be able to use as part of daily reflection practices. Now, if you've seen some of my other videos, you will know that I quite like to jump on here and talk about a particular theme that people can reflect on for the day if they are going through the process of addiction recovery. If you've been part of a 12-step program like AA, NA, or the likes, you might be very familiar with daily reflection books that provide a passage for you to read and reflect on through the process of your recovery. I like to write some of my own based on the clients that I see who are going through the process of overcoming an addiction, whether that be a substance or a behaviour in their life. I notice some common themes coming through that I think are valuable to speak to and to help people reflect on. So I like to write some of my own reflections and passages that I think might be useful for you to reflect on if you are going through this process yourself. So the theme of today's reflection is called What It Once Gave Me. I'm going to read out the reflection to you and then I'm going to provide a little bit of my own commentary as to what I see coming up a lot for patients that I work with, and also provide some of my own thoughts, reflections and insights on this theme and topic. So the daily reflection is what it once gave me. Every behaviour, even the destructive ones, started out meeting a need. Substances and compulsive habits often offered relief, comfort, escape, or belonging when nothing else did. Seeing that isn't weakness, it's honesty. It reminds us that our choices made sense in the context that we came from. Recovery asks us to recognize both sides, that our old coping strategies once helped us survive, and that they no longer serve the life we're building now. Today, I encourage you to take a moment and ask yourself, what did my substance or behaviour once give me? And then ask, how else can I meet that need now? Now, I wanted to talk to the theme of what it once gave me because this is something that I hear a lot of clients bring up in the therapy room, but not sit with in the therapy room. And so I guess what I mean here is that people will often be able to recognize that they maybe started using the substance or the behavior at a particular time in their life that was incredibly difficult. Perhaps someone was going through a divorce, or they were experiencing neglect in their childhood, or there were some really difficult life circumstances that came together for them at a particular point in time, and this behavior or this substance was something that helped them cope and sometimes even survive. Without it, some people feel like they wouldn't have been able to survive the circumstances that they found themselves in. So it's important to recognize and acknowledge where an unhelpful pattern may have started and why it was there in the first place. This is a really important part of the recovery process, to kind of acknowledge and give space to that. But as I said, often people want to move away from this quickly. They want to be quite change focused and talk about what they can do now and how they can be making changes in the process of recovery. And that's all well and good. But sometimes giving a little bit more space, acknowledgement, validation and compassion to our former self can be a really valuable place to sit. Really recognizing that this behavior, this addiction, came out of a place of not feeling like one could cope. I often say to people, no one chooses an addiction. No one thinks it'll happen to them. No one is set out on this path for themselves choosing it. But unfortunately, it does happen for people. And so recognizing that that behavior or that substance once actually served a role, it served a purpose, helps us hold competing emotions and ideas at the same time. We can recognize that on the one hand, this served me at a particular point in time, or maybe it even saved me at a particular point in time. And now I'm in a position where I don't need it anymore. It's not helpful. If anything, it's actually harmful. I don't need it to cope. It's not serving me. And so my goal is to get rid of it. Being able to hold this space for these two opposing thoughts and feelings and ideas is what we refer to as dialectics. The idea that two things that seem to be opposite can be true at the same time. And so I often encourage the people that I work with to take a dialectical stance. It helps us move away from black and white thinking or all or nothing thinking to be able to give room to both experiences, both sets of emotions, and both of the different kind of ideas that we might have. So I encourage you to reflect on what it once gave me means for you, where this substance or behavior perhaps emerged from, and how else it might be that you can meet your internal needs nowadays. We all have those inner emotional needs that we crave, that we need as children and as adults. So think about how you can better meet your needs today as you progress through the day, using this tool perhaps as your daily reflection. I wish you all the very best in addiction recovery, and please feel free to share your thoughts and reflections on the passage in the comments below.